Right now to answer more of your questions about the coronavirus and the vaccine. We have been doing this every day. We get so many of your questions. We love bringing them right to the experts. And joining us this afternoon is Lisa Cuchara, a professor of biomedical sciences at the Quinnipiac University School of Health Sciences. Professor, thank you very much for joining us this afternoon. We appreciate it.
Thank you, Mark.
Well, as I said, we get a lot of questions, so I want to get right to our first one. This is from Wendy from Norwich. She is asking, is it okay to get a second shot a day or two earlier than the 21 or 28 days recommended? You know, we've been hearing a lot lately about people who are concerned about it being delayed a week or so, but what about if it's early?
So certainly the clinical trials were not done with every possible permutation. So they're done with 21 or 28 days, but a day or two early is not going to make a difference immunologically. A week or two afterward is not going to make a difference immunologically. So that's certainly within a window of an immune response that would still give her protective immunity.
That is certainly some good news there. Now, Marianne from Brookfield wants to know, does taking a daily antihistamine like Claritin reduce the efficacy of the vaccine?
So there's no indication that an antihistamine would have any negative effects for forming antibody responses or mounting an immune response to the vaccine. I wouldn't recommend that somebody just start taking, something like that a couple of days before. I know sometimes people hear about the allergic reactions that are rare but concern for some people. So that's not really going to help with those anaphylactic type reactions. But if you're already on a daily dose of Claritin or something like that, absolutely still continue that. There's no contraindication with an immune response for taking that.
Okay, good news there. And finally for us right now, Karen from Vernon says, I take Tylenol arthritis on an almost daily basis per my doctor. How long before my vaccine should I stop taking that?
So there has been a lot of media coverage lately of don't start taking Tylenol or Advil or one of these other medications before your vaccine. Some people are trying to warn off some of the symptoms. But if you're already on a Tylenol regimen for something like arthritis, there's really no indication that you need to be able to stop taking that before your vaccine. Consult your rheumatologist or whoever is kind of prescribing that for you. But certainly there would be a pro and a con there as far as you're taking that for a chronic condition. We wouldn't want you to have a problem for that. But I wouldn't advise somebody to just say, oh, I'm going to start taking Tylenol, Advil, or one of these medications before the vaccine. The fever is actually a good part of our immune response, and we want to develop full protection to this virus. So we don't want to encourage anybody to take it that isn't already on it. But if you're on it for something like this as a regular maintenance type of thing, there's no indication that you need to go off of it.
A lot of people have emailed us for some time now about Tylenol and Advil after they get the shot. Briefly, what are your thoughts on that?
So my feeling is if you can not take it, it's better. Try just using a cool compress and try doing something that can do it. But if you have to take it afterward, it's not as bad as taking it before, where you could actually really prevent the immune response. But you want as much of a robust immune response as possible. So, feeling really icky and staying in bed for a day, I think would be a small price to pay for protective immunity and one step getting back to community immunity and normal life.
Oh, hey. I'll take it. All right. Lisa Cuchara from Quinnipiac, thank you very much for joining us this afternoon. We appreciate all of your expertise.
Thank you.
We'll have you back soon.